Hello everyone, and welcome. I'm excited to introduce today's presentation on non-invasive, natural health solutions. We'll explore how holistic care focuses on treating the whole person, not just symptoms, and we'll delve into the importance of understanding the nervous system as the master control system. Additionally, we'll highlight our specialized approach to musculoskeletal health, especially the spine and joints. And of course, I'll share a bit about the diploma in chiropractic therapy that supports this comprehensive approach. So, let's get started and see how these elements come together to promote better health naturally. Today, I want to highlight some of the key principles that are essential for our future practice. First, upholding professional ethical standards is absolutely crucial. It ensures that we maintain integrity and build trust with our patients. Next, applying evidence-informed interventions means we're using the best available research to guide our clinical decisions. This approach helps us provide effective and safe care. Mastering clinical assessment skills is also vital. It allows us to accurately understand our patients' needs and develop personalized treatment plans. These points all tie back to our overall goal, preparing students to excel in professional practice within integrative healthcare environments. This course is designed to equip you with these core competencies so you can confidently meet the challenges ahead. When we talk about chiropractic, it literally means done by hand. This hands-on approach is central to the practice. The Palmer School, which played a pivotal role in the development of chiropractic, was established in 1897. It was here that the core ideas began to take shape. One of the key concepts is the theory of subluxations, which are believed to interfere with the body's natural healing processes. Essentially, these are misalignments in the spine that can disrupt health. The very first chiropractic adjustment was performed on Harvey Lillard, a pivotal moment that marked the beginning of this field. And it all started a bit earlier, in 1895, when Daniel David Palmer founded the Palmer School. This history shows how chiropractic evolved from a simple hands-on technique into a structured health discipline. Understanding this background helps us appreciate the foundation of what chiropractic is today. When we talk about viewing the patient as a whole person rather than just focusing on individual symptoms, we're emphasizing the importance of holism. Holism is the idea that health isn't just about isolated problems, but about understanding the person's entire physical, emotional, and even spiritual well-being. This approach recognizes that everything in the body is interconnected, and that treating the whole person can lead to more effective healing. Now, related to this is the concept of vitalism. Vitalism is the belief that the body has an inherent life force, something special within us that drives healing and health. Both holism and vitalism are foundational principles in many healing philosophies because they emphasize the body's natural ability to restore itself, rather than just suppressing symptoms. So, when we look at these principles together, they remind us to see beyond just what's wrong on the surface and to appreciate the body's innate capacity for healing. This perspective is key to understanding a more comprehensive approach to health and wellness. Let's take a closer look at the different aspects involved in managing musculoskeletal health. Lifestyle counseling, nutrition, and rehab exercises play a crucial role here. They help patients adopt healthier habits and support recovery from injuries or chronic conditions. Moving on to management techniques, manual adjustments, mobilization, and soft tissue therapy are essential tools we use to improve function and reduce pain. These hands-on approaches are tailored to the patient's specific needs. When it comes to treatment, our focus is on identifying musculoskeletal conditions and spinal disorders accurately. This foundational step guides us in developing effective intervention plans. Lastly, understanding our scope of practice ensures we operate within professional boundaries, providing safe and appropriate care. All these elements come together to form a comprehensive approach to musculoskeletal health that promotes recovery and long-term well-being. Let's talk about some key points regarding our limits and responsibilities as chiropractors. First, it's important to understand that there are certain conditions, known as red flag conditions, that require mandatory referral. These are signs that something more serious might be going on, and we need to recognize them promptly. Now, I want to emphasize that our role is not a substitute for systemic disease treatment. If a patient has a condition that requires medical management, we need to refer them appropriately and not attempt to treat it ourselves. Similarly, we do not prescribe medication or perform surgery. Those are outside the scope of chiropractic care and could be unsafe. This brings us to a crucial point about recognizing our boundaries. Safety is paramount, and understanding the limits of what chiropractic care can provide is essential for protecting our patients. So the key constraints are clear. We provide care within a defined scope, and when there's a red flag or a systemic issue, we must refer the patient to the right healthcare provider. Staying within these boundaries ensures we deliver safe, effective, and professional care. Now, let's talk about integrating chiropractic services into comprehensive wellness plans. This is a really important aspect of holistic care because it emphasizes the idea that health isn't just about treating symptoms, but about supporting the whole person. When chiropractors become part of a broader wellness strategy, they can help address a variety of issues, from musculoskeletal health to overall mobility and function. This integration allows us to create personalized plans that consider physical, mental, and emotional well-being. It encourages collaboration among healthcare providers, ensuring patients receive well-rounded care that promotes long-term health. By incorporating chiropractic care into these plans, we're not just focusing on immediate relief, but also on maintaining optimal health and preventing future problems. It's about fostering a proactive approach to wellness, where chiropractic services play a vital role in supporting a balanced, healthy lifestyle. This approach aligns perfectly with our overall theme of holistic care, treating the person, not just the condition, and promoting overall wellness. Let's talk about some key principles that guide our professional relationships. First, boundaries are essential. Maintaining clear boundaries helps us keep our relationships with patients professional and respectful, ensuring trust and appropriate conduct. Next, integrity is at the core of everything we do. It means always prioritizing our patients' health and well-being over any financial considerations. Their health should never be compromised for profit. Confidentiality is another critical aspect. Protecting patient data and respecting their privacy isn't just a legal obligation, it's a fundamental part of building trust. Patients need to feel confident that their personal information is safe with us. And then there's informed consent. It's vital that we thoroughly explain the risks and benefits of any treatment or procedure. Patients should have all the information they need to make voluntary, informed decisions about their care. All of these points, boundaries, integrity, confidentiality, and informed consent, are foundational to professional ethics. They help us maintain trust, provide quality care, and uphold the integrity of our profession. Remember, adhering to these principles isn't just about following rules, it's about genuinely respecting and caring for our patients. Interconnectedness is key to function. When we think about the human body, it's really a complex, integrated system where each part plays a vital role. Nervous system, muscular system, skeletal system, they don't work in isolation. They work together seamlessly. The nervous system acts as the master conductor, sending signals that coordinate everything from movement to sensation. The muscular system is essentially the engine of motion, executing those signals to produce movement and strength. And the skeletal system provides the structural framework, giving our body shape and support. Understanding these foundational anatomy components is crucial for chiropractic practice. It's like knowing the blueprint of a building. You need to understand how all the parts fit and work together to maintain health and function. These systems are the foundation, and by mastering their interconnectedness, we can better support the body's natural ability to heal and function optimally. Remember, the overall theme here is that true wellness depends on how well these systems communicate and collaborate. Let's take a closer look at some key features of the spine. First, we have the bony landmarks for palpation. These are the points you can feel on the surface of the back, which help us identify the underlying vertebrae. Recognizing these landmarks is essential for accurate assessment and diagnosis. Next, intervertebral discs play a crucial role in allowing mobility between the vertebrae. They act as cushions, enabling us to bend, twist, and move our spine comfortably. These discs are vital for flexibility and shock absorption. Speaking of shock absorption, the natural curves of the spine are designed to handle loads and impacts efficiently. These curves help distribute stress evenly across the spinal column, protecting it from injury. Now, the spine consists of 33 vertebrae, which are organized into 5 distinct regions. Understanding this segmentation is important because each region has specific functions and characteristics that influence movement and stability. Finally, it's helpful to focus on the spine as the central pillar of the skeletal system. It provides support for the body, protects the spinal cord, and serves as a foundation for the attachment of muscles and other structures. All these points highlight the spine's complexity and its critical role in our overall structure and function. Let's take a closer look at the interaction between movement and control. This is where the muscular and nervous systems really come together to make our movements precise and coordinated. The muscular system provides the force needed for movement, while the nervous system directs and controls that movement. Think of it like a well-orchestrated team. Nerves send signals to muscles, telling them when and how to contract. This communication is essential for everything from simple actions, like lifting a cup, to complex activities, like running or playing an instrument. Understanding this interaction highlights how tightly integrated our body systems are, which is a key theme in understanding overall body function. So, in essence, movement isn't just about muscles working alone. It's a dynamic partnership with our nervous system, guiding every step. Let's take a closer look at the structures that keep our joints functioning properly. Synovial joints, ligaments, and fascia all play crucial roles in providing the stability and mobility we need for almost every movement we perform. Synovial joints are the most common type of joint in the body, allowing for a wide range of motion thanks to their fluid-filled capsules. Ligaments are tough, fibrous tissues that connect bones to each other, helping to stabilize the joints and prevent excessive movement. Fascia, on the other hand, is a connective tissue that surrounds muscles, bones, and joints, supporting and integrating the entire system. Together, these structures work harmoniously to enable us to move freely and safely. And of course, all of this happens within the framework of our bones, which form the foundation of our entire musculoskeletal system. Understanding these components highlights just how complex and well-coordinated our bodies are in supporting movement and stability. Let's take a closer look at the mechanical laws that govern human movement, which is a key aspect of biomechanics. Biomechanics is essentially the study of how our bodies move, and it's grounded in these fundamental physical principles. These laws help us understand how forces act on our bodies and how we generate movement. For example, Newton's laws of motion are central here. Think about how an object remains at rest or in motion unless acted upon by an external force. Our muscles generate forces that move our bones and joints, and understanding these interactions helps us improve performance and prevent injuries. Another important concept is leverage, how our bones and muscles work together like levers to produce movement efficiently. This ties into the overall theme of biomechanics, which is about understanding the mechanics behind our actions, from running and jumping to everyday movements. By grasping these mechanical laws, we gain insight into optimizing movement, whether for athletic performance or rehabilitation, making biomechanics a vital part of understanding human motion. Let's take a closer look at load distribution and joint motion patterns within the context of spinal mechanics. When we talk about load distribution, we're referring to how the forces and stresses are spread across different parts of the spine during various movements and activities. This is crucial because uneven load sharing can lead to areas of stress concentration, which may contribute to injury or degeneration over time. Now, considering joint motion patterns, these describe how the individual segments of the spine move in relation to each other. Understanding these patterns helps us see how mobility and stability are balanced in the spinal column. For example, during flexion or extension, certain joints are more active, while others provide stability. Connecting this to the overall theme, grasping how loads are distributed and how joints move collectively allows us to better understand spinal biomechanics, and ultimately, how to optimize function and prevent issues. These concepts are fundamental in designing effective treatment plans and ergonomic strategies to maintain spinal health. Now, let's talk about techniques for identifying deviations, starting with postural assessment. When we perform a postural assessment, we're essentially observing how a person's body aligns and functions in a static position. It's a fundamental step because it helps us spot any imbalances or misalignments that could be contributing to pain or dysfunction. The key here is to look for asymmetries or deviations from what's considered normal or optimal posture. For example, are the shoulders level? Is there a tilt or curvature in the spine? Are the hips even? These observations can reveal underlying issues that might need targeted intervention. It's important to approach postural assessment in a thorough but approachable way. We want to be systematic, checking from head to toe and noting any deviations. Remember, these deviations aren't just about appearance. They can impact movement, function, and even long-term health. Connecting this to our overall theme, proper identification of deviations through postural assessment is crucial. It allows us to develop tailored strategies to correct imbalances, improve function, and prevent future problems. So, always keep in mind that a keen eye during postural assessment is a powerful tool in our toolkit. Let's take a closer look at some common deviations in spinal alignment that we need to be aware of. First, we have lateral curvature of the spine, which is often called scoliosis. This condition requires careful monitoring because it can progress and affect overall posture and function. It's important to catch it early and keep an eye on any changes over time. Next, we see anterior or posterior shifts, which can influence lumbar stability. These shifts can lead to abnormal stress on the lower back, potentially causing discomfort or injury if not properly managed. Recognizing these shifts helps us understand how the spine maintains its balance and stability. Moving on, pelvic tilt is another key factor. An abnormal pelvic tilt can increase stress on the cervical spine and neck muscles, leading to discomfort or tension in those areas. This is why proper pelvic alignment is crucial for overall spinal health. Finally, we have forward head posture, a common deviation that many people develop from poor ergonomics or habits. It puts extra strain on the neck and upper back muscles, which can lead to pain and fatigue over time. All these deviations are interconnected and highlight the importance of maintaining proper spinal alignment. By understanding these common issues, we can better prevent, identify, and treat postural problems to promote healthier movement and reduce discomfort. Let's take a closer look at some key aspects of history and documentation. First, EHR, or electronic health records, are crucial because they ensure our documentation is accurate and legally sound. This is essential for patient safety and for protecting ourselves as healthcare providers. Next, when we consider lifestyle, we're talking about work habits, stress levels, and activity levels. These factors can significantly influence a patient's health and how we approach their care. Then there's symptom quality. Describing whether the pain is sharp, dull, or radiating helps us pinpoint the underlying issue more precisely. Finally, the chief complaint is a vital part of the history. Knowing the location, how it started, and how long it has lasted guides our entire assessment and treatment plan. All these elements, accurate documentation, understanding lifestyle, symptom quality, and chief complaint, are interconnected and form the foundation of thorough history-taking. They help us provide better care and support clear communication within the healthcare team. Now, let's talk about how we correlate our findings with the patient's history. Understanding their past and current symptoms helps us make sense of what we're observing. Next, we focus on identifying compensatory movement patterns, which are often subconscious adjustments the patient makes to cope with pain or dysfunction. Recognizing these patterns is crucial because they can influence our treatment plan. We also perform both orthopedic and neurological screening to get a comprehensive picture of the patient's condition. This helps us pinpoint specific areas that may need targeted intervention. Visual inspection plays a key role here. Assessing gait and symmetry allows us to catch subtle abnormalities that might not be obvious at first glance. Finally, adopting a systematic approach to clinical observation ensures that our assessment is thorough and consistent. Combining all these elements, history, movement patterns, screenings, and visual cues, forms the foundation of an effective physical examination. This integrated approach is essential for developing a precise and personalized treatment strategy. Now, let's move on to the hands-on assessment of tissue and joint function. This is a crucial part of our evaluation process. We'll focus on palpation and range of motion, or ROM. When we talk about palpation, we're referring to the skill of feeling tissues and joints to identify any abnormalities or areas of concern. It's like getting a tactile map of what's happening beneath the surface. ROM, on the other hand, involves assessing how much a joint can move in different directions. It's a key indicator of joint health and function. Remember, the goal here is to gather comprehensive information about the tissue quality and joint mobility, which will guide our treatment planning. Both palpation and ROM assessments are fundamental skills that connect directly to understanding patient complaints and overall joint health. They help us pinpoint issues early and tailor our interventions effectively. So, mastering these techniques is essential for providing the best care. Now, let's move on to recognizing indicators of serious pathology. When we're assessing patients, it's crucial to be aware of these red flags. These are warning signs that suggest there might be a more serious underlying issue that requires immediate attention. Some common red flags include severe or unrelenting pain, especially if it's sudden or intense. Also, if a patient reports unexplained weight loss, fever, or night sweats, those can be signs of systemic problems like infection or malignancy. Other indicators include neurological deficits, such as weakness or numbness that doesn't improve, or if there's a history of trauma, especially in older adults or those with osteoporosis. Keep in mind, these red flags are not meant to alarm, but to alert us that further investigation is necessary. Recognizing these signs early helps us prioritize patient safety and ensure they get the appropriate care promptly. Remember, these indicators connect directly to our overall goal of providing thorough, safe assessments and avoiding missed serious conditions. Now, let's talk about the principles of HVLA techniques, specifically focusing on spinal adjustments. When we perform these adjustments, the goal is to restore proper function and mobility to the spine. It's important to understand that HVLA, or high-velocity, low-amplitude techniques, rely on quick, precise movements to achieve these outcomes. The key point here is that these adjustments are designed to be safe and effective, targeting specific joints that may be restricted or misaligned. The quick nature of the thrust helps to release tension and improve joint mobility without causing unnecessary discomfort. Always remember, proper technique and understanding of spinal biomechanics are crucial. The adjustment should be applied with controlled force, respecting the patient's comfort and anatomy. Connecting this to our overall theme, effective spinal adjustments can alleviate pain, enhance movement, and support overall health. They're a fundamental part of many chiropractic interventions, aimed at optimizing spinal function for better well-being. Now, let's turn our attention to mobilization and soft tissue methods, which are essential components of manual therapy. When we talk about manual therapy, we're referring to hands-on techniques that help improve mobility, reduce pain, and promote healing. These methods are especially effective because they allow us to directly influence the tissues and joints involved. Key points to remember are that mobilization involves gentle, controlled movements to restore range of motion, while soft tissue techniques focus on muscles, fascia, and other connective tissues to alleviate tension and improve function. Both approaches are highly customizable, depending on the patient's specific needs, and they often work best when integrated into a comprehensive treatment plan. Connecting this to the overall theme of our presentation, Manual therapy enhances the body's natural ability to heal and function optimally. It's a vital tool in our therapeutic arsenal, helping us address restrictions and soft tissue dysfunctions that might be limiting performance or causing pain. So, understanding these techniques deeply allows us to tailor our interventions more effectively for each patient. Let's talk about reducing muscle tension, which is a key part of many soft tissue treatments. One effective method is massage, which helps relax muscles, improve circulation, and decrease pain. Another technique gaining popularity is instrument-assisted healing, or IASDM, where specialized tools are used to target and break down scar tissue and adhesions. Deactivating hyperirritable spots, often called trigger points, is also crucial. These are tiny knots in muscles that can cause significant pain and discomfort. Releasing fascia restrictions is another important aspect. Fascia is the connective tissue surrounding muscles, and when it becomes tight or restricted, it can limit movement and cause pain. That's where myofascial soft tissue methods come into play. They focus on releasing those fascial restrictions to restore normal movement and reduce tension. All of these approaches, massage, instrument-assisted techniques, trigger point therapy, and myofascial release, are interconnected. They work together to improve tissue health, decrease pain, and enhance overall function, which aligns perfectly with our goal of promoting optimal soft tissue health in our patients. When we talk about adapting for age or condition, it's really essential to tailor our approach to each individual patient. This means considering their specific health status and making necessary modifications to ensure safety and effectiveness. Checking for contraindications is a crucial step, making sure there are no reasons why a certain procedure or intervention shouldn't be performed on that patient. Screening helps us identify any potential risks early on, so we can proceed with confidence. Getting documented verbal agreement is equally important. It not only confirms the patient's understanding, but also their consent to move forward. Speaking of consent, it's vital that we ensure the patient is stable before proceeding. This helps prevent complications. Positioning is another key aspect, making sure the patient is in the correct and safe position to minimize discomfort and prevent injury. Throughout all of this, safety guidelines serve as our foundation, guidelines designed to protect both the patient and ourselves. When adapting care, always keep these principles in mind to ensure that we're providing the safest, most effective treatment possible. Let's talk about evidence-based management of spinal disorders, focusing specifically on back and neck pain. When approaching these common issues, it's crucial to rely on the best available evidence to guide our treatment strategies. This ensures that our patients receive care that is both effective and safe. Back and neck pain are among the most frequent reasons people seek medical attention, but not all interventions are created equal. Some treatments may offer little benefit or could even cause harm, so we want to prioritize interventions that have been proven to work through rigorous research. This means focusing on a comprehensive assessment first, understanding the patient's history, their functional limitations, and any red flags that might suggest more serious conditions. From there, evidence suggests that conservative management, like physical therapy, patient education, and encouraging activity, should be the first line of treatment. In some cases, imaging or invasive procedures might be necessary, but only when clearly indicated by the evidence and clinical findings. The goal is to avoid unnecessary interventions and focus on strategies that improve outcomes, reduce pain, and restore function. By integrating this evidence-based approach into our overall management, we align with best practices and improve patient care outcomes, reinforcing the overall theme of delivering effective, patient-centered treatment for spinal disorders. When it comes to treating headaches, it's important to recognize that they can often be caused by different factors, including cervicogenic issues or tension-type origins. Cervicogenic headaches are linked to problems in the neck, such as joint or muscular issues, which can refer pain to the head. Tension-type headaches, on the other hand, are usually related to muscle tightness and stress. Understanding these causes helps us tailor our treatment approaches more effectively. For cervicogenic headaches, addressing neck mobility, joint function, and muscle imbalances is key. For tension-type headaches, techniques that focus on reducing muscle tension, stress management, and relaxation are often beneficial. By identifying the underlying cause, whether it's cervical or muscular, we can develop more targeted interventions that not only alleviate pain, but also improve overall function. This approach aligns perfectly with the overall goal of our presentation, to restore health by addressing the root causes of these common headache types. Let's talk about extremity dysfunctions, specifically focusing on restrictions that can occur in the shoulder, hip, knee, and ankle. These restrictions are significant because they can impact movement, stability, and overall function. When any of these joints are limited, it often leads to compensations elsewhere in the body, which can cause further issues down the line. For example, a restriction in the shoulder might affect arm movement and upper body strength, while hip restrictions can influence gait and balance. Knee and ankle limitations often relate to mobility and weight-bearing activities. Recognizing these restrictions early is key to addressing them effectively and maintaining proper biomechanics. Overall, understanding these extremity dysfunctions helps us develop better treatment and prevention strategies, ensuring better outcomes for our patients. Let's talk about addressing psychosocial stressors, which are often overlooked but play a significant role in chronic pain and repetitive strain injuries. Managing stress, anxiety, or emotional factors can really improve treatment outcomes. Next, combining manual therapy with exercise is crucial. Manual therapy helps reduce pain and improve mobility, while tailored exercises strengthen the affected areas and promote recovery. Together, they create a comprehensive approach. Neuromuscular reeducation is another key component. This involves retraining the nervous system and muscles to work together properly, which can help correct faulty movement patterns that contribute to ongoing pain or injury. Preventing repetitive strain injuries is also essential. This means implementing ergonomic adjustments, taking regular breaks, and encouraging proper techniques during activities to reduce strain over time. Finally, long-term management strategies are vital. Chronic pain and RSI often require ongoing attention, including lifestyle modifications, continued exercise, and psychological support to maintain progress and prevent recurrence. All these points tie back to the overall theme of managing chronic pain and RSI holistically, addressing both physical and psychosocial factors to achieve better, lasting outcomes. Let's talk about functional strengthening, which is all about improving how our muscles work together to support daily activities. Endurance training plays a crucial role here, helping muscles sustain activity over time without fatigue. Proprioception training is also key. It enhances our body's awareness of position and movement, which is vital for injury prevention. Balance exercises are integrated to improve stability, making sure we can maintain control during various movements. Incorporating stretching programs helps increase flexibility, reducing stiffness and promoting better movement patterns. Spinal stabilization and core exercises are fundamental. They strengthen the muscles around the spine, providing a solid foundation for overall stability. Lastly, therapeutic exercises are tailored to address specific needs, ensuring a comprehensive approach to recovery and function. All these components work together to promote optimal movement, reduce pain, and prevent future injuries. Now, let's turn our attention to workplace and home environment assessments. These are crucial because our surroundings can significantly impact our health and productivity. One key aspect we focus on is ergonomics. Ergonomics is all about designing our workspace to fit us, rather than forcing us to adapt to an uncomfortable setup. When properly implemented, ergonomic adjustments can reduce strain, prevent injuries, and improve overall comfort. This includes things like the height of your chair, the position of your monitor, and the placement of your keyboard and mouse. The goal is to promote good posture and minimize repetitive stress. Remember, the better your environment supports your body, the more effectively you can work and stay healthy. This ties directly into our broader theme of creating safer, healthier workplaces, whether at home or in the office. Now, let's talk about how to identify and mitigate lifestyle hazards that can lead to injuries. One of the key aspects is understanding risk factors, things in our daily routines or environments that increase the likelihood of injury. To combat these, building resilience in supporting muscles is essential. Strengthening these muscles helps protect us during physical activities and reduces strain. Another important point is teaching proper body mechanics and lifting techniques. Using correct posture and safe lifting practices can make a huge difference in preventing injuries. Education is a powerful tool here. By learning and applying these principles, we can prevent many common injuries before they happen. All of these strategies, building resilience, strengthening muscles, and education, are vital components of injury prevention. They connect directly to our overall goal of maintaining a healthy, injury-free lifestyle, and by paying attention to these factors, we can significantly reduce the risks associated with our daily activities. When it comes to overall wellness, 3 key areas stand out: nutrition, stress management, and sleep hygiene. These are fundamental because they directly influence our energy levels, mental clarity, and recovery. Maintaining a balanced diet provides the essential nutrients our bodies need to function optimally. Managing stress effectively helps prevent burnout and supports mental health, while good sleep hygiene ensures our body and mind get the rest they need to repair and rejuvenate. Moving into lifestyle, it's also crucial to focus on structural integrity and movement optimization. This means paying attention to how we move daily, good posture, proper biomechanics, to prevent injuries and enhance performance. When our bodies are aligned and moving efficiently, it reduces strain and improves overall function. All of these elements tie into what I call physical wellness integration. It's about viewing health holistically, balancing nutrition, stress, sleep, and movement, so they work together seamlessly. When integrated well, these aspects support not just physical health, but also our mental resilience and overall quality of life. This comprehensive approach is vital for sustaining long-term health and achieving our full potential. Building trust is essential in any relationship, and one of the most effective ways to do that is through clear and empathetic dialogue. When we communicate with clients, we want to make sure our message is not only understandable, but also shows that we genuinely care about their concerns. Clear communication helps prevent misunderstandings and builds confidence, while empathy ensures they feel heard and valued. Remember, it's about creating a dialogue where clients feel comfortable sharing their needs and expectations. This approach aligns perfectly with our overall goal of fostering strong, trusting relationships. So, always aim for transparency and compassion in your conversations. It's the foundation of effective client communication. Let's take a look at some key concepts that are essential for effective practice. First, interprofessional collaboration is crucial because it brings together diverse expertise to improve patient outcomes. When different professionals work together, we can develop more comprehensive care plans. Next, outcome evaluation and adjustment are vital steps. They help us measure whether our interventions are working and allow us to make necessary changes to optimize results. This continuous process ensures we're always moving towards better care. Diagnosis and treatment planning are foundational. Accurate diagnosis guides us in creating effective, tailored treatment strategies that meet each patient's unique needs. Critical thinking and reasoning underpin all of this. They enable us to analyze complex situations, consider multiple perspectives, and make informed decisions rather than relying solely on routine procedures. Applying theory to real-world scenarios is where all these concepts come together. It's about translating what we've learned into practical actions that genuinely help our patients. And finally, clinical case studies serve as invaluable tools. They allow us to see how these principles operate in real life, helping us learn from actual experiences to improve our future practice. Altogether, these elements reinforce the overall theme of our presentation: the importance of a thoughtful, collaborative, and adaptable approach to healthcare. So, after 6 weeks of targeted adjustments and rehab, the patient's pain level has significantly improved, reducing to just 1/10 of what it was initially. This highlights how effective, consistent, personalized intervention can be. This case involves a 45-year-old office worker who has been dealing with chronic lower back pain for about 18 months. His pain tends to worsen with sitting, which is common for many office workers who spend hours at a desk. By focusing on proper adjustments and rehabilitation strategies, we saw a remarkable reduction in his discomfort. This outcome underscores the importance of a comprehensive approach, combining manual therapy, targeted exercises, and lifestyle modifications to manage chronic back pain effectively. It's a great example of how persistent, tailored treatment can lead to meaningful improvements in quality of life. This case was successfully resolved with ergonomic education, which highlights how important it is to understand and implement proper workplace habits. The patient was treated with cervical adjustments, addressing the neck issues directly and providing relief. The trigger for these problems was poor posture at the desk, a common issue for many desk workers. As a result, she experienced daily cervicogenic headaches, which are headaches originating from neck problems. She's a 32-year-old graphic designer, someone who spends long hours at her computer, making her particularly vulnerable. This case really underscores how crucial proper ergonomics and early intervention are in preventing and managing these types of headaches. It ties into our overall theme that addressing underlying causes can lead to effective and lasting relief. Now, let's talk about stability training and how it applies to different joints. For the ankle, we focus on functional rehab, which means exercises that improve real-world movement and help prevent future injuries. Moving to the knee, the goal is mobility restoration, ensuring the joint moves smoothly and efficiently again. For the hip, we address impingement care, which is about reducing pinching or irritation in the joint to restore normal function. Lastly, shoulder and extremity management involve tailored strategies to restore strength, stability, and overall function across these key areas. All of these components are crucial in our overall approach to comprehensive rehabilitation and injury prevention. Let's talk about HIPAA and privacy. These are crucial because they set the standards for protecting patient information. Ensuring confidentiality isn't just about following rules, it's about building trust with those we serve. Moving on to insurance, understanding how insurance policies impact our work is vital. They influence billing, coverage, and patient access to services. Regulations also play a big role here. They dictate what we can and cannot do legally, helping us maintain compliance and avoid penalties. Lastly, legal considerations encompass the broader legal landscape, including liability, consent, and documentation requirements. All these elements are interconnected and essential to operating ethically and effectively within the healthcare system, reinforcing the overall theme of responsible and compliant practice. Let's talk about how we can contribute to the advancement of our field. One of the key ways is through research. Engaging in research allows us to deepen our understanding and develop new approaches. It's especially important to specialize in areas like sports, pediatrics, or neurology, where focused expertise can make a real difference. Staying current with evidence-based research is crucial. It ensures that our practices are grounded in the latest and most reliable information, which ultimately benefits our clients and the field as a whole. Continuing education and professional development are also vital. They help us keep our skills sharp and stay updated on emerging trends and innovations. By investing in our ongoing growth, we not only improve our practice, but also contribute to the overall progress of our profession. All of these elements, research, specialization, staying informed, and continuous learning, work together to push our field forward and enhance the impact we can have. When exploring career pathways in this field, there are several key directions to consider. First, academic research plays a crucial role. It involves conducting studies to deepen our understanding and develop new interventions. This path is ideal for those who love inquiry and advancing knowledge. Next, corporate wellness is a growing area where professionals work with organizations to improve employee health, productivity, and overall well-being. It's a dynamic sector with lots of opportunities for impact. Private practice is another option, offering the flexibility to build your own client base and tailor services to individual needs. Finally, career pathways are diverse and interconnected, allowing you to find a niche that aligns with your interests and strengths, whether that's research, corporate settings, or private work. All these options contribute to the broader goal of improving health and quality of life, which ties back to our overall theme of making a meaningful difference in people's lives. Now, let's talk about practice management, which is a critical component of running a successful independent practice. Essentially, practice management involves the day-to-day operations that keep your practice running smoothly and efficiently. This includes everything from scheduling and billing to maintaining patient records and ensuring compliance with regulations. One of the most important concepts here is organization. Staying organized helps you provide better patient care and reduces the stress that comes with managing a busy practice. Good practice management also involves leveraging technology, like electronic health records and practice management software, to streamline processes and improve accuracy. Another key point is financial management. Keeping track of income and expenses, understanding billing procedures, and managing cash flow are vital for the sustainability of your practice. Remember, a well-managed practice not only enhances patient satisfaction, but also supports your long-term goals. Finally, always keep the overall theme in mind. Effective practice management is the backbone of a thriving practice. It allows you to focus more on patient care while ensuring your business operates efficiently and profitably. Let's talk about collaborating with multidisciplinary teams. When it comes to healthcare integration, working across different specialties and professions is absolutely essential. This approach allows us to pool diverse expertise, which ultimately leads to more comprehensive patient care. It's about breaking down silos and fostering open communication among doctors, nurses, therapists, social workers, and other healthcare professionals. By doing so, we can develop more holistic treatment plans that address all aspects of a patient's health. This collaboration not only improves outcomes, but also enhances patient satisfaction. Throughout this presentation, we've emphasized how interconnected and complex healthcare is, and working together across disciplines is the key to creating effective, integrated solutions that truly meet patient needs. Now, let's look at how we can optimize patient flow and staff management to improve overall clinic efficiency. First, scheduling is crucial. By carefully planning appointments and staff shifts, we can reduce wait times and ensure that resources are allocated effectively. Streamlined insurance and payment procedures also play a vital role. Making these processes simple and quick helps minimize delays and improves patient satisfaction. When it comes to billing, adopting efficient digital patient records and tracking systems is essential. These tools help us manage billing accurately and swiftly, reducing errors and administrative burdens. Lastly, implementing robust EHR systems supports seamless clinic operations, enabling us to access and update patient information effortlessly. All these elements, scheduling, billing, digital records, and EHR systems, work together to create a smoother, more efficient clinic environment, which ultimately benefits both our staff and patients. Now, let's look at the future of chiropractic and how it fits into primary care systems. One key aspect is integration. We're working towards establishing a standardized role for chiropractic within primary care, which means better collaboration and clearer pathways for patient care. Expanding the evidence base for manual therapy is also crucial. By strengthening the research behind our techniques, we can demonstrate their effectiveness and build trust within the broader healthcare community. Research is driving many of these advancements, helping us refine our approaches and validate our contributions. Additionally, the development of advanced diagnostic imaging and tools is transforming how we assess and treat patients, making our interventions more precise and personalized. All of these points, integration, research, and technology, are interconnected and essential for shaping the future of chiropractic. By embracing these innovations and positioning ourselves as integral members of the healthcare team, we can enhance patient outcomes and contribute meaningfully to primary care systems. As we come to the final slide, I want to emphasize our unwavering commitment to ethical, patient-centered healthcare delivery. This foundation is what guides every decision we make and every action we take. When we talk about professional excellence, we're really highlighting the importance of maintaining the highest standards in everything we do. It's about putting the patient's needs and well-being at the core of our efforts, ensuring they feel valued, respected, and cared for. This commitment isn't just a goal. It's a continuous journey to improve, to uphold integrity, and to serve with compassion. Ultimately, our dedication to these principles reflects the overall theme of this presentation, striving for excellence in healthcare that truly makes a difference in people's lives.